This is JadeCast, your gateway to traditional martial arts and Chinese culture. Brought to you by your host, Shifu Jonathan Bluestein.
Welcome back to the podcast. I'm happy that you're here with us today. And I would be speaking in a moment with a seasoned and well-regarded practitioner of traditional Chinese medicine from Israel, fellow Israeli Shaun Goodman, who is renowned for his skill and understanding, and especially in the field of acupuncture. So, Shaun, welcome to the podcast.
Oh, hi, Jonathan. It's great to be here with you.
So Shaun's been around for quite a while. I think you've been in practice for over 20 years now, right?
I think more. I graduated in 1995.
Oh, all right. Yeah. It's been a while since you started.
Yeah.
And Shaun is renowned for his expertise in what was originally a family system of traditional Chinese medicine focused on acupuncture, the world famous Master Dong system. It came from a certain Master Dong. So before we begin, since this is at the core of what you do on a daily basis, imagine someone is listening who is already a practitioner of traditional Chinese medicine, but has never heard of the Master Dong system. What should they know about it?
So, Master Dong, he was born in 1916 and he passed away in 1975 at the age of 60. And he practiced the family tradition. He was a part of a family acupuncture that was passed down from father to son, and he decided to teach his acupuncture system. It was a secret until 1962, where he started to accept students. And the reason he decided to teach it is because he wanted to preserve the culture, the Chinese culture. So he accepted students and he started teaching his system. So what's special about it is this is a chance to see a system that was secret and studying it. And there was a lot of acupuncture systems like that we don't know about. And he was very famous for his good clinical results that he managed to achieve with very few needles. And he's passed away. Since he's passed away, his system is spreading very, very fast all over the world, and I think it's because of its its clinical efficiency. So the system is a different system. It has 740 acupuncture points. We don't use all these points. We use most of about 250. Those are the main points that we use. And this system has its own tradition and own channels and different points. And it's a very interesting system.
Great. We'd learn more about it as we go along with this podcast episode. I'd like to ask you two questions arising from what you just said. First of all, why is it that the Dong family kept the system a secret for many generations?
I think it's because there's a lot, I don't know exactly why, but the history says there were times where acupuncturists were not allowed to practice, and sometimes they burnt the books a long time ago at the Qin dynasty. So that's one claim that they say. So to keep the system alive and not lose the system, they kept it secret. And also, I think it was the power of the power of the family. It's like a tradition that's passed from father to son, They only teach the males. They don't teach the females, to keep it in the family. And it's like a lot of traditions in China that were kept secret. So it's like I think it's to protect it, and also it gives you advantage on other people if you have a good system.
Yeah, that would be reasonable. It is for the same reason that many martial arts traditions were kept secret within families. And regarding something else you mentioned, so you said that in the Master Dong system, there are 740 acupuncture points. Do these 740 points include the 360 to 390 points ordinarily taught in colleges and universities?
No, Master Dong didn't write many books. There's only like 6 books that he published. And in his books, he does not tell you about the theory, about the principles and theory about his family tradition of acupuncture. But in the preface of the main book, the book from 1973, he writes that his system is not, they do not correspond to the 365 acupuncture points of the tradition in the 14-channel acupuncture. They are different. And he also says they're not in the same location. There are practitioners of Master Dong acupuncture that put some points in the same locations of the 365 acupuncture points, like there's a point called Tianhuan 7717. Some put it in the same location as spleen 9, but in Taiwan they don't. They put it in a different location, 1.5 tsun below spleen 9.
Oh, that's quite a distance, 1.5 tsun.
It's a distance. They are not in the same place. They are located in different areas, different locations, and so he says that it's not the same as the 365 channel points. He also says that the system is not based on the 14 channels. So there's also practitioners of Chinese medicine that practice Master Dong acupuncture, students of Master Dong, that do try to explain the system through the 14 channels. But Master Dong's saying is that this is a totally different system with its own channels, with its own, mainly with its own channels and own points.
That is quite interesting. And we do have to remember and remind listeners that albeit seemingly having the universal agreement that Chinese medicine is one thing, in actual reality, Chinese medicine had only become that one thing via the bureaucratic mechanisms of the Chinese Communist Party during the 20th century. Prior to the middle of the 20th century, Chinese medicine had not quite been one thing, albeit the herbalism, the acupuncture, and other methods, all of these were influenced by a similar tradition, similar terms, similar ideas, similar theories, and certainly by many common classical texts. But nonetheless, there are many streams and lineages and commonly held within families, some of which were quite different to the traditional Chinese medicine we know today. And it is a fascinating movement within the world of traditional Chinese medicine today that suddenly some of those family lineages are coming into the light and are being taught by people such as Mr. Goodman right here. So in Israel, you are considered a forerunner and promoter of the Master Dong system of acupuncture. Can you briefly tell the listeners how you transitioned from standard traditional Chinese medicine to the Master Dong system?
I think like a lot of other people that start practicing Master Dong acupuncture, I started because I was really studying meridian theory, and in 2007, I started to study with Ilan Migdali. He brought the balance method of Richard Tan to Israel, and I studied that method. And he started mentioning that points. Richard Tan is from Taiwan, and he uses a lot of Master Dong's acupuncture points. So that's the first time I heard about the name Master Dong. And he recommended a book written by Wei Qiang on Master Dong acupuncture. That's one of Master Dong's students that tries to explain Master Dong's acupuncture through the 14 channels. So
is that a book you would recommend, by the way? Could you repeat the name of the author and of the book?
It's not a book maybe that I recommend. It's a good book, but it's not, he has a few books in English. He practiced in England, in the United States. He moved from Taiwan to America. He also was in Israel, and he taught in Israel.
What is his name again?
Wei Qiang.
Wei Qiang.
Wei Qiang. Yang Wei Qiang. And we can maybe leave the name, but I'm not sure. His approach is like something that I went through stages studying Master Dong acupuncture. It's something that's the beginning when I started learning about Master Dong acupuncture. So Wei Qiang's approach is trying to teach Master Dong acupuncture for 14 channels. So really, it was at the time it was good for the way I was thinking, because I was studying the 14 channels. So like I could incorporate Master Dong's acupuncture points in what I was studying. 14 channels, so I could use like both systems at the same time. Okay, so that's the beginning. So I started using Master Dong's points in this perspective. I even taught it for a few years. I had courses, channel theory and using Master Dong's points together. But then in so that's how I started using Master Dong acupuncture, and slowly. This acupuncture was very interesting to me, and I wanted to learn about it more and more, and learning about the principles and the secret, because Master Dong did not write any books telling the principles behind his system. Even Yang says that Master Dong did not talk a lot. He did not talk a lot to his patients. He did not talk a lot to his students. And he used to always say to them, observe and think for yourself. So like it's Chinese approach that you need to figure it out by yourself. So the way Richard Tan figured it out, not Richard Tan, Yang, he figured it out through trying to understand Master Dong acupuncture through the 14 channels. But there's other disciples that look at it in a different way. There are disciples saying, like Master Dong says, that his system is a totally different system. So later on, I started, first of all, in 2013, there was a different disciple of Master Dong. This book I really recommend, of Chang Ming Wan. Chang Ming Wan, he published a book in English. He lives in America on Master Dong's acupuncture, and saying that Master Dong acupuncture is a totally different system based on the 5 Zan. So there's 5 channel system. So then I started getting interested in this approach, and in 2016. I went to Taiwan. We organized with Gilton. Gilton was a student of mine that went to Taiwan to do a PhD in Chinese medicine, in acupuncture. And when he went there, so we need to find a connection to Master Dong there, and he managed to do that. So we organized 3 trips to Taiwan, where we studied with Li Guzhen. And that was the second time that I started to see a different approach to Master Dong's acupuncture using the 5 Zang. Okay, so the transition was like very easy for me, because at the beginning it was like the same language. I was using meridian theory, using Master Dong in acupuncture points, and then slowly realizing that it's a different system. So I started changing the way I was looking at the system, and that's how I practice it today.
So the challenge would be that if one was to apply the same theories from the modern take on traditional Chinese medicine, what is taught in colleges and universities, to the Master Dong points and their indications and uses, there wouldn't be a direct correlation, then that might cause misunderstandings. Is that what you're saying?
Yes. look, in a certain way, you could look at it through the 14 channels, but it's not accurate. It's not what Master Dong, what his intention was. And you could use the acupuncture like that, and it gets good results. I used it like that before. But I always was on a quest to understand what Master Dong meant, to understand. And today, after really researching and studying so much and looking for so many sources, I know today that it's a different system. He says it for himself in his preface of the book. So I think it's best, it's a simple system. So I think it's best to study it as a 5-channel system from the beginning, and not, because it could mix you up also. That the way I went is because that's the information that was that I had. I didn't have all the information. But after I don't, I have students that studied with me before, and they said, "You are different now." I'm different. I changed. Okay, so it's what I taught before is not so accurate. I understand today that it's different, and so
I think this is a very mature statement to be made by a teacher. And as a martial arts teacher myself, I can understand and relate. And this is often a problem that is posed by students when you speak or attempt to teach people whom you've been with 5 or 10 years ago. They can have a difficult time comprehending that you're a different person now, and that your understanding and comprehension of your art has evolved. And they would often rather stick with their old image of who you were than go along with you into the future.
Yeah. And it's good that change is like the basic principle of the universe. So, if you want to go with the chi, you need to change. And that's also, I think, I don't know anything. Like, I'm still learning. So, I'm not the same person as I was yesterday. I hope that I'm changed. So it's like, it's a principle that I think is good. And yeah, I agree with you.
So do allow me to challenge you on something you were just saying. Since we have asserted that the Master Dong system has a different conception of how to work through Chinese medicine and acupuncture, there is a certain type of criticism that I've heard of the Master Dong system from people who do not practice it, who primarily engage with the typical TCM that we all know. And such people would often say, oh, yes, this Master Dong system, it has its efficacy. All right, I've seen it work, but what does it all mean? I see this point has these 20 indications, and that point has 40 different indications. It doesn't make sense. I guess those people who do the Master Dong system, they simply go by prescription of what the point should do, and it then sort of takes them in the direction and the mindset of modern Western medicine. Oh, here's a symptom, here's a symptomatic solution, this point solves that symptom, which would then make the system appear almost simplistic. So what would you answer to such people, and how would you deepen their understanding of what it is that you do and the theory behind it?
Okay, first of all, the most important, like Chinese medicine, diagnose. And they're trying to say that Master Dong is just a symptomatic, the points are just symptomatic points. You just treat the indication, but that's not true. In Master Dong acupuncture, the most important part is treating the root cause and not the symptoms. And that's misunderstanding of the acupuncture. It's just like looking at the points and not understanding the principles behind. And Master Dong, there is a, like in Changming's book, Changming-Wan's book, he gives a lot of cases of Master Dong. And you could see in these cases that the most important thing for him is to understand which zang is damaged. Okay, so it's a 5 zang. So if you diagnose that this is a spleen problem, and then you need to needle points, and you have like in TCM, it's the same. You have like points that treat headaches, and these points are on a lot of channels. How do you know which points to use? You need to first understand which channels are involved, diagnose. Macedon, it's the same, but the diagnosis is based not on 12 channels, on 5 channels. So you need to understand which Zang is in disease. And you see, most of the times, even Macedon, he's not treating the symptoms. He'll just treat the Zang. He'll just treat the organ that is diseased. And maybe just one point using symptoms. So Macedon is not a symptomatic, it's not a system of recipes, of point combinations. Diagnosis is the most important part, and he used to use palm diagnosis. That's a very important aspect in Macedon's acupuncture. Face diagnosis and use the pulse. And after diagnosing, he would choose the points. And there's one other aspect of Macedon acupuncture that makes it very special and different, but I think we'll talk about it later. Okay, I don't think it's time to go into it yet, but it's a whole system that has a diagnosis and then treatment, and you treat the root and you treat the symptoms exactly as TCM. It's not different to TCM.
In order to elucidate what you mean for listeners, could you perhaps provide us with 2 or 3 examples? Just pick from your very rich and vast experience of treating patients, 2 or 3 examples of conditions which would be a tad more difficult to treat with TCM, but are very appropriate to treat with the Master Dong system.
Okay, so I have a patient now. It's the second time she's coming to see me. It's just from yesterday, okay? So it's like fresh. And she has her platelets in pregnancy go down. Okay, like, and this is her 4th pregnancy. She came to see me the first time on her 3rd pregnancy. Before she did acupuncture, okay, and did not help. She needed to, at the end of her pregnancy, because if you have low platelets at the end, it's not good because you could have a lot of bleeding during childbirth. So the doctors are very worried about it. So she came, the first time she came, I treated her, and she managed to go through the whole, she had a natural pregnancy, and she did not get steroids, okay? She's coming here again to me, and I treat her. First, I want to understand what's weak in her constitution, and she's a spleen type. That's in my I diagnosed the spleen. So then I choose points that treat the spleen. Okay, so I treat points that could also treat what we call the organ, the spleen. And also in Macedon, we have points that could treat when we say spleen in Chinese medicine, there's 3 things that could be related. It could be related to the spleen itself, the organ. It also could be related to the pancreas, because we talk about digestion, digestive enzymes, and it could also relate to blood. Okay, so in this aspect, I want to use points that are also related to the organ, because we know in the spleen maybe it has relationship to destroying blood cells, and also in relation to the blood in TCM. So I use points that treat both these principles. So that's what I'm treating. I'm treating what I diagnosed, and the platelets at the beginning, they stayed stable. They're not going down. And she came to me yesterday, and she said not only that they are stable, they went up. They are increasing 1,000. And I also changed the treatment a bit. I changed the points. Maybe I'll talk about it later. And what I used to be more accurate on the points. So that's one example that I could give you of Macedon acupuncture, how efficient it could be, and using diagnosis, because I could have treated maybe a different patient, I would treat it through the liver, and a different patient, I would treat it through the lung. I'm not treating the disease. I'm trying to treat the organ. Okay, so that's involved, the 5 zang. Okay, so this is a example where we could find a correlation between the symptoms and the root. Okay, because the spleen is in charge of blood in Chinese medicine. Okay, so
if I were to play, devil's advocate, coming from the TCM perspective, I would say, yeah, you know what, that's not special. Yeah, we would, use spleen 1, spleen 6, very typical TCM points to treat this. What's the difference? I can solve this with TCM.
okay, but I gave this example on purpose because she went to practitioners of TCM before the first 2 pregnancies, and she didn't have results. So, and this is the second time she's coming to me, so it's not coincidence. The first, it's more interesting. That's why I'm bringing this case, because it's the second time. She's the second pregnancy. This is a 4th pregnancy, and I've seen this increase. Not only that it's going down, it's even increasing. So before it was going down and going down. She's now on her 37th week. Okay, so
could you briefly just give an overview, which is listener friendly, again, for those who are not that familiar with the Dong system, as to which types of points and their locations that you're using? Not going too deep into it, just to give a perspective of different physical locations as compared with TCM.
Yeah, okay. First of all, in Dong acupuncture, we use a lot of points on the hip area, on the thigh, the tibia bone, the femur bone. And those are the most tonifying points in Dong acupuncture. And that's one of the advantages of Dong acupuncture, using points there. And we have on that area, we have points to treat all the 5 zang. And Dong is also very special that we use sometimes 3 or 5 needles on the same line. Okay, so that's also the needle end technique in Dong acupuncture is also different to TCM. Okay, it's not only just the theory and the points, it's also the way we needle. And so I was using points there that treat blood that are related to the spleen in that area. And we know that area we have one of the biggest bones in the body. The femur bone, and we know in these big bones, this is where blood cells are in the bone marrow are made, are
generated. Yes,
generated. Yeah. Okay, so this area Dong is a very tonifying area, and I think it's one of the reasons Dong acupuncture is so powerful compared to TCM. We're using points in an area TCM nearly doesn't needle, and that's the main area Dong used to treat the root of the cause. Okay, so that's like the most important area. Like the one area, the area of the hands, is a more yang area. It's an area that's more treating. It's the most yang. The face and the fingers are the most yang. It's like yang in yang, because we say the hands are yang, the feet are yin, and the extremity is more yang than the close to the body. So this area is very, very young. So I use also points. I use 2 points here that are called enlarged spleen. Okay, so they're more treating the symptoms. They're more treating the presentation. Okay, so I use that's the 2 groups of points. And one other group of points that's on the shin area, that's main points in Dong acupuncture, also for treating the spleen. So it's called the free weights. They don't treat blood, they treat more the spleen in general. So those are the points that I used. It's hard to tell somebody that doesn't know Dong acupuncture, but what's interesting here is using the hip area that normally we do not use in TCM. And that's also what's very special in Dong acupuncture. And I think that makes it more powerful.
That would make a lot of sense to me as someone with a background as a gym instructor and later for many years and still a martial arts teacher. The thighs, the area of the hamstrings and the quadriceps is exceedingly blood rich and can be quite thick in terms of muscle mass. Often it is the area with the relatively the most muscle mass on a man or a woman's body. And so it would make sense to use that area to tonify.
So I want to just add different, because you mentioned that. I don't want to mention too much information, but so if we look at it in a muscle dong perspective, so we have a muscle and we have a big bone. Okay, so a muscle is related to postnatal chi. Okay, because it's the flesh. The flesh is related to spleens, that's nourishing, and the bone is to kidney, and kidney is related to prenatal chi. So we are tonifying the post and the pre together when we're using this area in a very extreme, maybe the area that we could do it the most, because it's the biggest muscles and biggest bone.
So from the TCM point of view, and perhaps also from the Master Dong point of view, would it be correct to assert that the thigh area is an area that harmonizes the relationship between spleen and kidneys?
In a general way, we are treating, no, I wouldn't say that, because I'm saying in a general way, we're using this area to treat prenatal chi, the essence, and postnatal chi. And in that area, we'll be able to treat the liver, we'll be able to treat the kidney, we'll be able to treat the heart, we'll be able to treat the lung. But why this area is so strong, so powerful, is because of that. Okay, and like Master Dong, I said this area is more treating excess, it's more treating the manifestation of the disease. It's also, we diagnose through this area because it's the area where the yang goes to the surface. So Master Dong, it's very interesting. He uses the palm to diagnose and the face. It's yang areas where we could see how something internally is manifesting on the surface. And not only that, we have 5 fingers. That's another, each finger is related to one of the zang. So it's again showing it's a 5 zang approach.
Yeah, this is a very traditional point of view that is still commonly used in various types of Qigong, especially lineages of Qigong that use sound mantras along with the fingers, where you relate each of the fingers on your palms to a different organ. And these relationships indeed are not channel related. So they are not necessarily affiliated directly with the channels that pass through the fingers as taught in TCM, in modern TCM.
Right. So Master Dong is coming from this kind of tradition. I know he's like, we see a lot of Taoist influences in his practice. The names of the points and a lot of clues of a Taoist practice.
By the way, when Shaun was talking about the use of 3 or 5 needles together, what he meant was that in the Master Dong system, often 3 different points with the same margins between them. So 3 or 5 different points, each 1 tsun, 1.5 tsun, or maybe 3 tsun apart from one another, would be needled together on a single line. And that is quite a unique approach that is actually seldom seen in the modern take on TCM. So unless you do something such as, for example, needling lung 5, pericardium 3, and heart 3, then you don't commonly see 3 and certainly not 5 needles on the same line. And in the Master Dong system, this is quite a common modality. Could you tell us just briefly, why is it used in that manner?
Well, that's like a big question. Okay. And it's big and very simple. And I think it's the basis of the understanding of what is a channel in Master Dong acupuncture and what are the points in Master Dong acupuncture. And the points in Master Dong acupuncture are organized in sets of 3, 4, or 5, mostly 3. And it's called a dauma, these 3 points, the needle and technique. It's when you needle not only one needle, you needle 2 or 3 needles on the same line. And each line like that is a channel in Master Dong acupuncture because each line is related to one of the zangs. So in Master Dong acupuncture, we have these channels that are all over the body. It's not like one channel for the heart. We'll find the heart channel in a lot of areas throughout the body. Okay, and then we come, and when we diagnose the heart channel, we need to try and understand which of the heart channels we should needle on the body. Okay, so that's a more of a diagnosis process that we need to do using Master Dong acupuncture, because we have a lot of channels like that. Which channel to use? So basically, we decide how to use, which channel to use through observation. We look at the points. We want to see changes on the skin. We want to palpate. Okay, so Master Dong is not a prescription based medicine, because there's two ways to practice medicine, Chinese medicine. You could practice it as a scientist, and you say, okay, these points do this and that. This point does that. This point does that, and just needle them by thinking. But the true art of Chinese, the true Chinese medicine, I think, to practice Chinese medicine in its best way is to practice it as an artist. And when you do it as an artist, you are looking at the body and observing to know where to needle. And you're not using your head. You're looking, the body's telling you where to needle. And there's a very famous saying in Master Dong acupuncture from Dr. Hu Wenjie, one of Master Dong's main practitioners, that he revealed all of the 740 points of Master Dong. And he says, non-existing points, non-existing locations are better than existing points and existing locations. So this is like it's like the main principle of Master Dong acupuncture.
Okay, so that wait a moment. That was quite perplexing. So if you could kindly repeat that statement and then explain it to listeners.
Yeah. Non-existing points. Okay, so you're needling a point that does not exist in the books. Non-existing location. Okay, a point that doesn't have a location, like written in the book, is better than existing point. Then, like I say, then a point that has existing location. That means there's a point in Master Dong acupuncture that's named 7717, the upper emperor. But if you want to really use that point properly, you need to look and see where it is. And maybe it's not exactly where the book tells you it is. Okay? And so we have a line with 3 points on the line. That's a dauma. So these 3 points are giving you the area of the point where you should needle. But you need to look in this area and see. You need to palpate and look for changes on the skin to know where to needle. Okay? So you see, that's how you practice Master. That's how I practice Master Dong acupuncture as an art. So I'm looking at the body. So it's not like you said, TCM, you gave me, they look at these indications and you put, like, it's what's Master Dong acupuncture. No, it's much more, there's a depth to it and simplicity. You need to read the body, you need to palpate, you need to look for like blood vessels, changes in the skin, and changes in the tissue. And Master Dong said that in chronic diseases, rheumatism develops. And at the beginning, I said, and because rheumatism develops in the tissue, one needle is not enough. To free the flow of the tissue, you need 3 needles to do this. So, at the beginning, I said, where is this rheumatism happening? Is it happening in the organ, or is it happening in the where? I don't understand. Today, I understand that it's happening in the area of the points. So you could feel it when the tissue changes. You feel changes at the points. The tissue becomes, there's nodules in the tissue. Sometimes it feels like more hard. It's not so soft. It doesn't have. So you must look to find where in the 3 points, where in the channel, this area is, you find the stagnation. In that area, you put 3 points or 2 points. Okay, so that's really, and each area like that is like a channel in Master Dong acupuncture.
Yeah, that's a very good answer. That's quite an interesting take on the medicine. I would like to ask, in the Master Dong system, are there certain types, thicknesses, or lengths of needles which are preferred, or is it the same as with TCM that each practitioner works with what they personally feel an affinity to?
Well, at the end, everybody works with what I think what affinity to. I think that Master Dong used very thick needles, but also he practiced a time where the needles were not disposable needles. They used the same needle again and again. So of course the needles need to be thick. Normally they say the thicker the needle is, the better. Yeah, but sometimes in the West, people could not tolerate thick needles, like in China. And so it's also about needle technique. And so the best is to use thicker needles. It's obvious, but not sometimes you can't use. But if you use less thicker needles, you could use more needles. And so I like the people we studied in Taiwan, Li Guzhen, we were surprised so much. He uses so many needles. Like, wow, it's like not what Master Dong used. Master Dong used between 6 and 8 needles. He used a very few needles. And the length of the needle is where you needle. There's changes. Like in the thigh, we use longer needles. We have in the fingers, we needle very shallower. So we use smaller needles. So we adapt the needle to where we're needling. And also we adapt the needle to the patient, I think. The thickness, I don't use one thickness of needles. I have a lot of needles, different sizes.
When you meet with resilient patients who could, quote unquote, take the pain and are interested in a powerful treatment, which thickness of needle would you prefer if you could work with a thick needle?
30.
30.
That's what I use.
Even on the palms sometimes?
No, on the palms, no. Palms I use 18 or 16.
Yeah, that makes sense.
You don't need to use thick needles on the palms. They are so sensitive, the points. They are full of nerves. It's like, it's not an area I need to use thick needles.
I see. And Master Dong, just out of curiosity, were his needles also 0.3?
I don't know what size, but I just saw a picture of his needles. There in one of his books, there's a picture like, it's where the needles are all bent and crooked. But I'm sure he used thick needles. And because if you use a needle again and again, it needs to be thick. I was at this bend.
It makes sense, certainly. If you use it again and again, it has to be thicker than 30 even.
Yeah, I don't know what size he used. I really don't know. I don't know. But I'm sure he's using what was common in that time. And maybe today, if he was practicing, he would use something else. The needle, we're not using the same needle that used in Ling Shu. Yeah, we're using a bit different needle. Their needles are the higher quality. They're using better needles today. Maybe that's why we could use more needles also.
So many people argue that retaining needles for over 40 minutes can, again, quote unquote, exhaust the patient's qi. However, in the Master Dong system, you commonly retain needles for an hour, sometimes even longer. Why do you retain the needles for such a length of time? And what do you think about the claim that this could exhaust the patient's qi?
Well, that's a big myth about that if you retain the needles more than 25 minutes, it's that you are exhausting the qi. It's interesting. Gil, a year ago, he gave me a podcast of a person named Leo Locke. He's
yes.
You know him?
Yeah, he's a pretty well-known internet TCM personality.
Okay, so he has a podcast talking about the retention of needles in the classics. And he brings evidence of retaining of needles for much more than 25 minutes. and even up to an hour. So also in the past, the claim that you must do it for 20 minutes, it's not based on anything. It's based like on the Ling Shu of how you're breathing and seeing how long the qi is, one cycle of qi is happening. It says 20 minutes.
Yeah, the cycles of qi in the body. I mean, my teacher, Shifu Oren, actually looked into this and found that people say 20 and 40 minutes, but actually that the cycles of qi in the body are shorter, that it's more akin to something like 12 to 15 minutes, and then two cycles are closer to 30 minutes. So even the 20 to 40 minute thing is not that accurate.
Yeah, but who said you need one cycle? And also, I don't think anybody really knows how many cycles the qi goes. It's like it's just the truth is the practice. Okay, I believe in not the theory. I believe in the practice. But I just wanted to mention that there are people in the text saying that they did retrain for more than 25 minutes. It's not the only 25 minutes like the West, they do in the West. And in China, they also retrain for longer. And I could tell you what happens in the clinic, especially in the modern age. I think one of the most important, there's no problem. People don't feel exhausted after the treatment. They feel a bit different. They feel they got energy. And what happens is when you get an acupuncture treatment, I think one of the nicest things I like when I get an acupuncture treatment is I call that the acupuncture sleep, is you fall in like a deep, deep, deep meditation. And it's very special for acupuncture. And I really want my patients to get into this state. So you come like from a very busy, hectic environment, and now you need to quiet down. Some patients, it takes them just half an hour to quiet down. So then I give them over 15 minutes of like deep sleep. The truth is the time of retention of the needles is something that you need to observe and look at the patient to decide when it's the right time to take the needles out. It's not something that you must measure with the watch. And some patient could one day stay for an hour with the needles, and the next treatment maybe just for half an hour because he's restless. He didn't calm down. So it's not something you must measure with a clock. I could leave needles. Each patient I see, I work in 2 rooms. So I could see a patient could be in my clinic for an hour. Okay, so in that hour, that's the time I give him. So in that hour, sometimes I'll leave it for, it takes me like 10 minutes to put the points in, and then he has them over like 40 minutes to lie with the needles. And so that's the goal. I'm not worried that I'm exhausting the patient. It never happens, okay? Because I practice that way all the time. People that say that, they have not leave needles for longer. They don't know what they're talking about. I mean, try leaving needles for longer and then seeing what happens and then decide about it. Okay, so it's okay. And also there's a lot of evidence that they also left needles for a long time. That's how I answer the question.
All right, makes sense. Well, speaking with honesty though, the retainment of needles for over 40 minutes is not a lucrative business proposition if we were to cynically think of this as just from the financial angle. What will you tell those practitioners, especially in North America, who believe that retaining needles for over 40 minutes reduces your potential income?
Because if you work, I think acupuncturists need to not work only on one bed at the same time. Because I think that's why this is happening, because that's the reason. They want more, they will see only one patient at a time. So they want to see more patients. But the true way to practice acupuncture is not seeing the same patient for an hour. You must see a few patients, or at least 2 patients in 1 hour. In China, like Hu and Jie's clinic, you go in, the clinic is full. There's no rooms. People are sitting down and getting needles. And they see like a lot of patients in 1 hour. That's how they practice acupuncture. It's not the way you practice in the West, that you sit with the patient for a whole hour and, what do you do when he's lying with the needles? Yeah, what are you doing? Looking at him? You want to leave him alone also. I want the patient. So you're wasting your time. You should work with 2 rooms.
Well, some people are needy. They want you to stay around. But I think probably the reason we have a somewhat different modality in the West, aside from the cultural expectations, because the Chinese come to a doctor often expecting a mechanic, fix me up so I can go home. And I think in the West, people have this unspoken expectation that the Chinese medicine practitioner would also be their psychologist. Now, this is quite controversial because a lot of people, such as my distinguished teacher, Professor Jakovitz, would say, no, you're not a psychologist. Don't try to be their psychologist. He's very adamant about that. And perhaps he's right. But the trouble is that even if you yourself are not playing the psychologist and you're not attempting to do a clinical psychology session, for a great majority, sometimes a majority of the patients, there is a strong psychological element, even if it's in the confines of a 5-minute conversation. And especially in a country such as Israel, where people are very spiritually inclined, they're looking for that guru to solve their spiritual problems as well, even if they don't say it. So they come in and they have this image of you. You're supposed to use those needles, yes, but you're also a psychologist and a shaman and a rabbi, and you're everything. Of course, you're supposed to be, and if somehow, God forbid, you don't fulfill any of these expectations, right? So I don't know that this is something that we can actually change within the span of a single generation. Maybe in the West, to transition people from such expectations to how people behave in a Chinese clinic in China, that might take a few generations. What do you think?
First of all, I agree so much with your professor. And I think, I know he's a Taoist, right?
Yeah, Shaun here is when he says he's a Taoist, he means my teacher, Professor Jakovitz, who is also a Taoist priest, yes. And
I'm sure that he knows that the Shen is very important in any disease.
Mm-hmm.
Okay. So I'm not saying and I agree with the saying we are not we don't sit and talk to the patients for so long, because we must address the Shen is the most important thing in disease. Okay, we have every disease has a physical, an energetic component and a Shen component. Okay, so it's like every disease has these 3 things. But the Shen is something that it's the patient's Shen. And the Shen is the way he looks at the world and communicates the world. Now, I always want to address this aspect, but I'm waiting for the patient to give me permission to address it. And it normally starts, why did I get this disease? That's the question. Okay, so then the answer is yes, that's a very good question. Why did you get this disease? Now, let's maybe talk about, when did this disease start? What happened to you? Now, maybe think about it. I'm putting him on the path. I don't need to talk to him for a whole hour. If you know, there's a saying, I studied also with Jeffrey Yuan, and he's talking about the channels in a classical perspective. And he said, what's the difference between the channels, acupuncture, and herbalism? He says herbalism is external medicine. The herbs you need to, you could learn about this herb, you could learn about this herb, but it's from taking herbs, looking at herbs from the outside. The channels are in each of one of us. And to investigate the channels, we need to look in the channels in ourselves. Okay, so the channels, studying the channels is also, it's a path of internal cultivation. So when you do this on yourself, you could tell the patients with not a lot of words, if you practice this approach, put them on the right path and leading the Shen to look at the disease in a certain way, and trying to teach them that the disease is also manifesting a conflict or something that's happening in their lives.
So you're alluding to the Chinese terms Neigong and Daoyin, right? Because the Neigong is the internal work. In traditional Chinese internal martial arts, it has its definition. I've written a book about this, research of martial arts. But my colleague, Master Neil Ripsky, he has this very lovely definition where he says, well, Neigong is anything that transforms you energetically from the inside. And then you raise the other one, which is Daoyin, and you're basically using Daoyin to guide their Shen within themselves, right? You're basically pushing them in the right direction internally, which is, I think, a very high level of skill. You require a very high level of skill to do this with a patient, and it is saddening that this is not a skill being taught anywhere in colleges or universities.
Because you could not learn this. You could just practice it. And the first, you need to practice on yourself. You need to do these practices on yourself. And I did this for years. And then after you understanding and seeing it on yourself, you could maybe teach your patient. But and the patient needs to be ready for it. Not each patient, when the question comes from the patient, you don't say, I tell the patient sometimes, okay, now you lie down with the needles. At the beginning, go into your pain, be present of the pain, relax your body. Okay, I maybe say that, but then the patient needs to ask, the patient needs to communicate. And then I give an answer. I'm not wasting my energy. The answer is simple. I don't need to talk with the patient for a whole hour to make a change. And I'm sure Professor Jakovich is the same. I know. Okay, so he's not addressing the Shen. He's addressing it, but not in a Western way. Okay, it's more in a. So it's if you want to learn how to do it, start doing Daoyin. That's how you study it. There's no shortcuts. Okay, but don't think you are a psychologist and you need to be a psychologist, because even if the patient has expectations, so what? So I don't need to fulfill the expectations of the patient. Yeah, I'm not worried about the expectation of the patient. It's you must have solid roots in your foundations, and believe me, if you have these roots, the patient will maybe not go to a different doctor, but okay, you're not the right doctor for him. But most of the times he will adapt to you and not you adapt to him. Okay, so
I'm in full agreement with this, and that brings to mind what Sun Samyao said, that the first thing to do is to control the patient's Shen.
Right. That's the most hard and the most important. Yeah.
Now, when they step in the door, and they're basically what happens is when they come inside the clinic, it's a new environment. Even if it's not their first treatment, they're coming in a new environment and they're trying to assert their Shen. Meaning, if we talk in a Western psychological language, they have a script and they're coming in with their script. Much like I see in martial arts, people come in and they ask you silly questions like, what is your base stance when you fight? Because here in Israel, Krav Maga is quite common. And when people practice Krav Maga, and often also in various schools of karate, and they tell them there's when you fight somebody, there's a base stance, which is, I think it's an idea that actually comes from combative sports. But in actual physical reality, in everyday life, in street combat, you do not necessarily adopt a specific stance. Rather, you stand based on what is required in the moment, based on the situation. So people come in, it's like, what is this? What's the base stance in your style? Mm-hmm. And in my teachings, for example, this is not even a relevant question. But this question is asked in the context of again, this here is not a patient, it's a student, but it has the same mindset of attempting to assert their script, right? They want to use their language, their terminology, their idea of how things should be in your class. And the first thing to do is to bring them over to your side without offending them or making them feel that you are rejecting their script.
Right.
Which is a very fine art.
Yep, I agree with you so much. It's the same, exactly the same.
So, briefly, when studying a system of Chinese medicine, such as the Master Dong lineage, that is a lifelong endeavor. But that being said and considered, how many hours should it take a dedicated practitioner to obtain the foundations for that system in a manner sufficient for successful everyday clinical use? So I'm asking this from the perspective of, say, someone is already an accomplished practitioner of Chinese medicine, or maybe they've just come out of Chinese medicine college or university. They want to get into the Master Dong system, but they're thinking, oh my God, I just spent 4 years of my life studying this TCM, do I really have to spend another 4 years to get the Master Dong system, or how many hours, or what is the span of time before they can use it effectively in the clinic?
If you are a practitioner of TCM, then you could do a shortcut. You don't need to study so much. You could course for between 35 to 40 hours, a basic course, just to get to know the system. The system is based on Chinese medicine. It's based on what you learn, like the theory of Chinese medicine. And so it's just like learning a different approach to acupuncture. So that's enough to start. And then, of course, you need to investigate you need to study more, but that's enough to start getting into the system and starting using the system in your clinic. And then you could learn, you need to study more, but that's the beginning. It's not something that acupuncture is a lifetime science, because we learn from our experience. So every system after you learn, you start using it and then continue studying and continue going into the system. But the basic system, to learn it is very, very simple. If you learn the principles, so the principles are very important. And if you have a very good foundation on the principles, it's afterwards you are very easy, if you're a practitioner of TCM, to continue studying by yourself after like a 35, 40-hour course.
Yeah, so that would make for a foundational course. And your long-term courses which you teach that span a few months, how many hours are there?
I teach two different. I used to teach, like I said before, I used to teach Master Dong acupuncture with meridian theory. So I have a course like that. That's like a 31-year-old, 31 classes of like 4 hours each class. But that's not only, that's learning what I used to do before, the integration of Master Dong acupuncture with the 14 channels. And it's also studying not only Master Dong acupuncture, channel theory, understanding, because channel theory is something that is not studied in the TCM clinic, in the TCM schools. Even in Riedman, where I used to teach, they teach a channel theory course, might be because of me. I put the course in the curriculum, but even then, it's just the basics. To understand meridian theory, you also need to practice it in the clinic and see how to use it. Mm-hmm. So it's more a Zhang Fu approach, a syndrome based approach when you study TCM at least in Israel.
So your old way of teaching was taught in courses ranging anywhere between, let's say, 120 to 130 hours, right?
Yeah, I don't know how many hours. Yeah, something like that. Yeah, and that's the meridian theory, not only Master Dong. But to study
nowadays,
what?
And nowadays,
I only teach what I practice. Then when I taught that course, I was practicing doing that kind of practice, and a lot of people, I still have that course because there are people still practicing TCM, and they come and study that course, and it's like, I think they tell me it's mind blowing. It's to see like Chinese medicine in different perspective through the channels. So I still have the course for people that are interested into combining the two approaches, because there's not one way to practice. I'm not saying this is the way you should practice, this is the best way. I used to practice that way, and I have the information, and whoever wants to learn can learn. But today, I only use Master Dong in my clinic. So I teach a Master Dong course, so I have a basic course, and then afterwards, I continue studying how to like bloodletting, palm diagnosis.
We're pausing the interview for just one moment. You can pause the recording and we'll continue momentarily. Okay, so you work a lot with bloodletting. When I told a fellow practitioner I was going to interview you, he jokingly asked, "You mean Shaun the vampire? That guy, Shaun the vampire, for the blood?" And I'm a fan of bloodletting myself. However, bloodletting has had a bad reputation amongst the general public, as the mainstream media commonly portrays it as an anachronistic medical practice. Due to this silly brainwashing, many TCM practitioners outside of China, I should say, are averse to bloodletting as well. They come out of TCM college and they should have been taught some bloodletting, but they don't feel that comfortable with it. What do you think could improve the reputation of bloodletting among lay people and practitioners alike?
Well, first of all, when people hear bloodletting, the first thing is they say it's like the medievals,
medieval times,
medieval times, and they think about that's the first thing they say. And that at that time they used to take out liters of blood, and people used to die from bloodletting. Okay, but in Chinese medicine, people do not die from bloodletting. It's like very safe, and it's practiced for centuries. And I think if you really want to use acupuncture the way it was used, then you need to do moxa, you need to do needling and bloodletting. It's like the three main techniques doing acupuncture. You can't just do, you could do only moxa, you could do only needles, but all three of the techniques together give you a very powerful medicine. So bloodletting is very, I think to know what's bloodletting so important is to learn why we do bloodletting in Chinese medicine. And after you understand why we're doing it, I think it's easier to accept it. Okay. And the second is its efficiency. You know, Dr. Hu and Jay, like I told you, I started using bloodletting through Master Dong acupuncture. Bloodletting is a very important aspect of Master Dong acupuncture. And we go to his clinic, I was there. He says, okay, you want a treatment to last for long, or you want a short treatment? Short treatment, bloodletting. Long treatment, acupuncture. So it's incredible sometimes. It's so surprising how fast the results are using bloodletting. Okay, so that's, I think, the two main reasons why I could tell people that, try to persuade people to do bloodletting. And I do it all the time and I have no problems. The patients accept it, and they maybe at the beginning they say, medievals, but it's like a joke. They're all willing to accept it. The only problem is insurance. Not everywhere there's insurance. And in Israel, we have insurance for bloodletting. It was not like that a year ago. This is something new. So we're insured. So we're not letting out a lot of blood. We leave very small amounts. Maybe some people will see me do bloodletting and think that it's a lot, but it's not really a lot, okay, compared to what they used to do in the medievals.
All right. So since Shaun's family are already nagging him, I'll ask 3 more short questions and we'll have to wrap up. In another interview, you said that during the early period of your career, when you were just beginning to build your clientele, that you were gardening part-time to make ends meet. You worked as a gardener in people's gardens. And I wanted to ask you, what is similar between gardening and Chinese medicine?
Yeah, I think even though gardening or being close before I started learning Chinese medicine, I was always interested in plants from a young age. And I think it was like that's what also brought me to Chinese medicine, because I was going to learn to or biology or to be agronome. I don't know how to say it in English. It's like a doctor of the flowers, of the plants.
Mhm.
But I was always interested in using herbs, plants to treat myself without even knowing about Chinese medicine or herbalism. And so before I started studying, I said, okay, maybe I would study this perspective of the plants. And that's how I got to Chinese medicine. But working as a gardener, it makes you are close to the changes in the seasons. It like brings you Chinese medicine is very important, how the qi is changing through the every season and the changes in the seasons. But when when you're working in the gardens and you all the time, half the day you're outside and you see how the change happens in nature. So it helps you more to connect to these changes. So that's, I think, what it gave me using Chinese, being a gardener.
And do you feel it gave you an edge in the practice? Is it something that because other practitioners do not have in terms of experience that helped you realize certain things that they could not?
I don't know, but it's like for me, I'm aware of the changes, and I think a lot is because of the gardening.
Mhm.
I don't know if I don't know. It's just that's the way I don't know if it gives me advantage. I think working with the ground is very important, and working outside and not being inside all day long was nice, but it was very tiring also.
Mm.
Like, yeah, at the beginning, I used to work as a gardener at the beginning, and then afterwards go to the clinic. And it's like I was younger, I had more energy. Today I said, how did I do that? How could I do like together?
Yeah,
It's like,
gardening is physically demanding, especially if you do it as a profession. Yeah.
yeah. But I was gardening in my village where I grew up, like it's a kibbutz. And I was doing the kibbutz gardening, also the hotel. There's like a hotel. So it was like I wake up in the morning, I take the tractor and it's like going. So it's like it's a bit different. It's not the same.
So Shaun's background was as an agronomist. That is the word that he was looking for. Here in Israel, we say agronome, so an agronomist, an expert in the science of soil management and crop production.
Yeah. So that was my direction, and I was not. I thought that it was not really what I wanted to do. So before I started learning, I said maybe I'll take a different path, just check it out, and that's how I got to Chinese medicine by chance.
So, despite your affinity to plants, nowadays you mostly practice acupuncture and do very little herbalism. What made you shift your focus in that way from herbalism to acupuncture?
I think the main shift happened because of my teacher. My teacher named Dr. Avraham Abu Chatzera. He's not an acupuncturist. He's an osteopath. And he's the one that I learned so much from him. And I learned osteopathy from him, a certain kind of osteopathy. And he has a saying in osteopathy, says that osteopathy has room for only one for osteopathy. There's no room for other techniques. If you bring something in, you lose something from osteopathy. And it's not good to mix medicines because you won't develop.
And nowadays, do you still agree with that statement?
I agree. If you want to be a good acupuncturist, you should do only acupuncture and not herbs.
That is a controversial statement right there.
I know, but at the beginning at least, because I think it's very hard to, first of all, to study at the beginning both of the techniques in depth. I'm on a path of I want to be a master. Okay, and a master does one thing. In one thing you have everything, and I think if you can practice, you can do both things, but you won't be as good acupuncturist if you do only acupuncture, because I even see in the clinic when I taught in a clinic of TCM where you do herbs and acupuncture together. And every time the patient used to take acupuncture and do herbs at the same time, for the student was positive that the herbs was what helping him and not the acupuncture. So when you like in acupuncture, you do something and you want to get a result. And if you don't get a result, you need to change what you're doing. But if you have herbs that you're also giving, how do you know what's changing? So for that patient, it does not matter. But for the next patient, it does, because you don't understand. You don't learn anything. And we call it in English to practice. We are practicing. And if you want to get better, you should, in acupuncture, it's better that you do only acupuncture for at least a few years. Afterwards, you could start maybe integrating herbalism in your treatment. But I think you'll be a better acupuncturist if you do only acupuncture. But okay, that's what I think. And I stopped using herbs because of that, and also because when I got in love with the ability of healing somebody without nothing, just needles, and without taking anything, with this like using the healing properties of the body. And that's what's so special about acupuncture. And I just fell in love with it. And so that's also more drawn to acupuncture.
So a final question for you. How about we create a fun imaginary scenario? So let us imagine that Master Dong was still alive today and that he had been invited by you to come and visit Israel. What would Master Dong think about this country and the way that both TCM and his system are being practiced here?
Oh, I don't know, but I think he'll be surprised that his name is known in Israel. I think that's it's like he'll be very surprised. Look, Master Dong, he requested that his 1973 book be translated to English, and he asked one of his students, a Tibetan student, to translate it, and he did translate the book. So he's aware of the opportunity of his system to be spread to the West. But I don't think he would imagine in his craziest dreams that also in Israel, people would practice Master Dong's acupuncture. I think that's, he will be, I don't know if he'll be happy the way it's practiced. I really don't know. I hope so, but I don't know. But for sure, he'll be very surprised.
Do we have time for just one more short question?
Yeah, we have.
So I think, especially for the seasoned practitioners listening to this interview, that would strike a note. You've been a practitioner of Chinese medicine for over 2 decades now. What keeps you going in the profession on an everyday basis? What motivates and inspires you in this profession?
I think what inspires me is the meeting with the patients and the magic that happens in the clinic, modulated with the needles, that the shen, the magic that happens, that keeps me going every time when this happens. I'm not saying I see this magic with every patient, but I see it a lot. And this is what the quest to see the magic for every patient keeps me going, to understand. And it's really a shen, working with the shen, that is inspiring and keeps me going.
You offer both in-person and online instruction in Israel and worldwide. For those who would like to gain more from your wisdom and experience, where can they find you and how could they reach you?
I think the easiest way is now in English is my Instagram page. It's called needle.end. You can also find it if you look for Shaun Goodman.
So Shaun Goodman is spelled S-H-A-U-N, Goodman, 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 Shaun Goodman. So you can look him up on Instagram, and where else?
I also Facebook.
Is your website also available in English?
My website is not in English. I'm going to be making, when I finish writing, I'm writing a book now. When I finish writing the book, I'm going to make a website in English, but right now I don't have one.
So the book, Shaun told me earlier, would hopefully be published by the end of this year, so by the end of 2023. Would this book concern the Master Dong system?
Yeah, it will be about the Master Dong system.
Fantastic. So that will be your first book, correct?
Yeah, that's right.
Okay, so that is a unique perspective that is going to come into writing. Stay tuned for that book, and if you're listening past 2023, it might already be out there. Would it be available on Amazon?
No, right now I'm writing it in Hebrew, and afterwards it will be translated. But when that will happen, I don't know yet.
All right. Hopefully sooner than later.
Yeah.
Shaun, thank you so very much for sharing from your wisdom and experience with us today.
Yeah, it was great talking to you. It was very interesting, and I really enjoyed it. Thank you very much.
Yeah, hopefully we can bring you again in the future. There are a bunch more questions that we didn't get to, and there's a whole lot more to learn. So again, thanks a bunch, and we'll catch up next time.
That's great.